This program is brought to you by the Georgia Neurosurgical Institute. For over 50 years, rendering neurosurgical care to patients of all social conditions, treating complicated problems involving the brain, spine, spinal cord, and peripheral nerves. Endeavoring to encourage quality care, medical research, innovation, and education on a local, national, and international basis.
Good evening. My name is Joe Sam Robinson. It's my pleasure to have with us tonight Mr. Robert Holl-Allen. Welcome, Robert.
Thank you.
Now, maybe we could talk a little bit about your title, which is you're a physician, a surgeon, and I called you Mr. Is there a reason for that?
We're all qualified doctors, but it's traditional that surgeons take the title of Mr., which dates back to the Tudor times.
Yes.
Where the surgery was done by the barbers.
Oh, really?
In fact, there is a society called the Barber Surgeons, run, partly
yes,
of surgeons who have an interest in history. But that's the origin of the...
So it's a little bit different in the UK. So the physicians are a regular internist, would be I guess a fellow of the Royal College of Physicians, and surgeons would be the Royal College of Surgeons.
That's
and
right.
There's a difference.
Physicians are always called doctor.
Yes. But so Mr. is sort of can I say that in this genre, kind of a higher title in a way, isn't it? Or would you say that? Or
no,
possibly?
I think it's a courtesy title.
Well, Robert, it's good to have you with us tonight. We can talk about some of your adventures and maybe your observations on healthcare. So you did your training as a surgeon in the UK, and how did that happen?
Yeah, I started, in fact, as a physiologist.
Really?
And did a degree in physiology as part of my medical training.
Yes.
And then I did my clinical studies at University College Hospital.
Yes.
And then started my surgical training, which was a bit haphazard. Because
really?
You had to apply for positions at the end of each training period.
Yes, yes.
You didn't have continuity of training. And it wasn't until I came to the United States to work that I appreciated the training system here, which I thought was very good. That you didn't have to move house or apartment.
Yes, yes.
And you had 5 years, providing you were capable.
Yes, yes.
That, I think, was my first impression that it was very good. It has defects. The British system has changed, very similar, trying to get through training, as we call it, but they still have to apply for a post and hope they get a particular post, so it's not the same.
Right. Well, let me start out by making inquiries about University College. Now, is that the college that Jeremy Bentham was connected with? And is there a story about him appearing there on a yearly basis?
Well, he founded the college for £1 million then, but provided there was no religious worship or lectures.
Yes.
And it's still the same. But there's an icon, an auto icon of him that's pulled out for the annual dinner.
Yeah, so basically it's sort of a stuffed, he's sort of been stuffed and in a big hat, and they sort of wheeling him out. Is that correct?
Right.
Yes, yes.
It's quite weird, really.
Well, okay, it's a little charm to it. So your training was sort of a variegated arrangement, and that's kind of the way it is in the UK. And
yes, it was interesting. One had to plan one's own career. You didn't have it decided for you.
Yes.
This was the difference I found with the United States. You knew that you were going to do 5 years here.
Yes.
And at the end you'd become board certified.
Correct.
Whereas we had to hope that we could get the right steps and so on.
Yes.
I was extremely lucky because I only did 2 years at what they call middle grade, and then I did a year as an attending locum.
Yes.
In a small hospital, which gave me confidence in myself. I then became a chief resident and spent nearly 3 years total in America doing work.
Where were you in the States?
At the famous Peter Bent Brigham Hospital.
Oh, that's up in Boston. That's a really famous place, and
it was.
the Harvard Medical School
that's
is
right,
there,
yes.
and so It's a big deal.
I was very lucky because Dr. Moore was, of course, the most famous surgeon of his time. But I was paired with Joe Murray.
Oh, yes, who won a Nobel Prize, I think.
That's right. The most modest man you could ever meet. Absolutely superb.
Yes. And he pioneered in kidney transplants, did he not? And
that's right. But I think he also wanted to be famous for his craniofacial surgery.
Oh, really? He did that as well, is that correct?
And he was marvelous.
Wow. So you really had some pretty substantial training and both sides of the Atlantic. And where did your career take you in your travels?
Oh, I was very lucky as a physiologist. I went to a conference in Hungary, and we just got off the runway before the invasion occurred.
Yes.
Then I went to meetings all over, but it wasn't until I started in the United States that I really traveled.
Yes, yes.
I think I went to about 18 of the United States in my
really?
career in Boston.
As a teacher and a
yes,
lecturer?
giving lectures
Yes.
or attending conferences or seeing something being done. That was interesting, meeting the people who were really making the news at that time.
Yes.
Like Tom Starzl, for instance,
Right,
and Norman
right.
Shumway.
Right. It's at Stanford and yes,
They're
Pittsburgh,
good, great names.
Yes.
And then when I became an attending, I was again lucky because the British Council got me organised to go and take over as a visiting professor in various parts of the world.
Now you've really been around the track, have you not? I mean, you've really been to
a fair number
there are
of
not
places.
many countries you missed in your travels. I mean,
the most interesting was Iraq, surprisingly.
Yes.
I was there before Saddam Hussein became president.
Yes.
And it was a lovely country.
Yes.
The language of instruction was English.
Yes.
The standard of medicine was outstanding.
Yes.
A lot of instructors were people like myself who spent out a month, and we were also examiners, so we set the standard, and I must say, I was most impressed.
Now, did the word come down for you to be a bit severe in your examinations? I think you'd mentioned that. You're a pretty tough examiner. And,
well, I'm not tough, I'm fair.
Fair.
I think
right.
fair is a more accurate word.
Yes. All right. So you were fair, but it was, so the standard of the physicians in Iraq was quite high. And that was your...
One or two that I trained came to England and I trained, and they've now settled somewhere in the United States, I believe. So they must be pretty competent.
Well, there's been sort of a migration of, I guess, intellectual skills here in some ways. That they're, for whatever reason, they're attracted to life in the States. Well, and I think you'd mentioned that you actually had met Saddam Hussein just as part of your travels. And how did that happen? I mean,
well, he used to come to the hospital and do various things. And I operated on various members of his family and staff at times. But he was very charismatic, highly intelligent, but uneducated. That was a tragedy, I think.
So in a way, obviously he came to a bad end and led his country in some bad directions, but he had a provincial kind of limitation, not really been too many places or had a worldview that...
He was very tribal.
Yes.
And I think that was probably the main problem. But he did pull Iraq into the 21st century from about the 15th century.
Yes. So there's a lot of oil money, too, a lot of petroleum wealth that helped the process.
He also imported some brewers and produced one of the best beers I think
is that
I've
right?
ever had.
Okay, all right. Well, so his time wasn't totally...
no.
They have great beer there.
Well,
they used to.
Alcohol was freely available anyway.
Which is an Islamic country, and I guess the Ba'athist Party was pretty secular, and they allowed it.
No, well, apparently there's no reason why they can't drink alcohol, but they mustn't get intoxicated.
Oh, is that right? So it's no law against it in the Quran. Oh, okay.
Apparently.
Well,
so I'm told.
So you've been to many different places. I mean, we exchanged stories that I had an invitation to go give a lecture or two in Paraguay, and it turned out you'd been there.
Yeah.
So
yes, I've been to South America. The last time was with my wife. We went to Ecuador because I was co-chairman of an international conference.
Oh, really? Was that in Quito or up in the mountains?
Quito,
in the
yes.
mountains, yes.
And that was interesting too. Standard of surgery in the main hospital
Yes.
was very much the same
Yes.
as anywhere in the world.
Yes.
But it's like everything, it's a matter of money and politics.
Well, you've observed, I guess, healthcare in a developed country, and you've been to places where the healthcare systems are not as developed. What do you think needs to happen? I mean, how can we? Do you think the Western skills? Is it a money issue? What's the best relationship between
I think it's a money issue because just recently, and I mean, I've read our national paper today. There's tremendous problems with the health service in the UK.
Yes.
One of the senior members of the confederation that runs the health service says it's like a large liner approaching an iceberg.
Yes.
The crisis in the health service, and it's
Yes.
financial.
Well, let's talk a little about that. You know, in the U.S., in our program here, we discuss some of the issues that I guess either elevate the American healthcare system or afflict it, and money is a big part of it. But in the UK, the system is pretty much a government-run system. Is that correct?
That is the problem because they virtually control healthcare.
Yes.
You cannot be an attending, I use that word so that you understand, unless you've actually worked within the government and been trained by them.
Yes.
You can't set up in private practice until
Yes.
you've completed your training.
Yes. So the government really controls healthcare in a way that's difficult to imagine in the States.
But once you're an attending, you can participate in private work
Yes,
as well as
yes,
the national
yes.
health. We have a lot of advantages being in the health service. We get a salary, we get a pension at the end, which is
Yes,
quite generous
yes.
relatively,
Yes.
and your malpractice insurance is paid for,
Yes.
except in the private sector.
Yes. Yes.
Which of course means that it's you have very few worries if you're full time.
Yes.
I mean, over here, as I see it, a lot of the cost of healthcare is defensive medicine.
Yes.
Dare I say it?
Sure. What is defensive medicine?
Where you over-investigate patients
And
to
you
make
do
sure you don't miss anything.
And that
might-
costs a lot of money.
that costs
That's
money.
a lot of money, yes.
And from what I gather from colleagues where I teach at the moment, the cost of malpractice insurance is not cheap.
It's very high, isn't it? Yes, yes. So that's a difference in the system. Well, you mentioned you'd been reading the British papers. Now, I understand a doctor's strike is brewing, which is almost unheard of in the States, but what exactly is going on? Why would the doctors strike in the UK?
I will be quite open, it's greed. They're striking because the government have decided to change the way that they calculate their pensions.
Yes, yes.
Which means that some of them may have to work an extra year over
Yes.
the age of 60.
Well, when is the retirement age there? For
Well,
the
you can
physicians?
retire as an attending at 60
That sounds pretty nice. 60? Really? Wow.
with a full pension, which is half your salary,
Wow.
plus a lump sum of 1.5 times your pension.
Well, isn't this some of the problem that we're observing in Europe in general? The pension systems are extraordinarily generous, and the social benefits are just, there's not enough money to pay for all
That's
this.
right. It's becoming very expensive to pay for it, and the doctor's pension scheme is really very generous indeed.
Yes.
And I feel sad for the profession because it gives
Yes.
us a bad name. As it happens, I gather the majority of doctors are not going on
Yes,
strike.
yes.
They're ignoring the actual word now.
Well, so there's some conflict between the government and physicians. Now, the government pretty much says how much money can be spent for what. Is that correct? So if you come in, I mean, we could say some good things about the UK system, but one of the problems is that if there's not enough money there, you might not get your hip replaced. You might be on
That's
a
right.
waiting list.
Well, your waiting list, this is one of the arguments. The government say, well, we've got cut waiting lists, we've cut this, that and the other. But they haven't. The cost of healthcare in the UK, in my opinion, is like a diamond on its point.
Yes.
The point is the patient,
Right.
and the people treating him or her are the immediate next. The rest are administrators.
Right.
About 80% of them really don't know what they're doing.
Well, now, good. Let's get that out in public because, you know, in our U.S. healthcare system, it may well be that we have another mechanism to control costs, which are administrators that may make the situation worse. Now, in the UK, is it common to see people with notepads walking through the hospitals and
if
making
you ask
notes?
them what they're doing, they don't know.
They're making notes, but they work for the government, and their idea is, in some way, rationing health care. I mean, isn't that really what goes on in the UK? The government says you have this much money, you just can't have it. It's
They
just,
keep putting money in, but I think that all it does is increases the administrative level.
Yes, yes.
And I see what's going to happen here is I think there's problems with the potential of providing a federally funded healthcare system.
Yes, and you think it'll just be the cost, the inefficiencies will increase, the cost will increase.
Yeah.
So you're concerned about that?
I would be very concerned. Also, with the government controlling medical practice, and
yes,
I have to be fair. I think that medical practice varies from state to state.
Yes,
the requirements are different.
Right. Yes, it's a little funny here, isn't it? I mean, it's not a uniform system in the U.S.
Yeah, and I feel that a federal system may not be good for every state.
Yes.
But on the other hand, I think also costs could be cut. And dare I say it, by first of all educating the patients.
Yes.
I think most people think that they have perfect bodies that will react the same as everybody else.
Yes.
And that everybody's Dr. Kildare.
Yes.
And when something goes wrong,
Right.
that's when they start to get worried. And I think they should be educated that this is not the situation,
Yes.
that things can go wrong, and their bodies don't react sometimes as they should do.
Yes.
And I think that would help cut the costs. Secondly, I think that the surgeons are frightened under the circumstances into doing defensive medicine, and if the threat of mass litigation, which I call
Yes.
it really,
Yes.
was removed, a lot of defensive medicine would go. That would bring down the costs.
Do you think in the UK there's less defensive medicine, or people,
Yes.
and are the patients in a way, if I could say it this way, less demanding? They just accept the situation a little?
By and large, if the situation is explained to them and that things can be put right,
Yes,
not
yes,
necessarily
yes,
by you
yes,
as a
yeah,
surgeon
right,
or
yes,
physician,
yes.
they're much more tolerant about
Yes,
accepting what's
yes,
gone.
yes.
But they like being told the truth.
Well, who does it? Who
Yeah.
does it? Yes.
And I
yes.
think that's probably part of the
Good
problem.
and bad news. Good and bad news. They
And
like-
then the third thing I see very sadly that the elderly and the really chronically ill, it's very expensive getting their treatment over here. They
Yes.
find it difficult to pay for
Yes.
their medicines.
Yes.
I'd like to see the elderly being given the right to have medicine at a nominal cost,
Yes.
not at what they have to pay.
Now, is that the case in the UK? Do you think the
No, I take medicine quite clearly, but if for a monthly supply of my drugs, it would cost me about $700
in the UK
here.
here? But what it would in the UK would it be?
Shall I tell you?
Would it be free or nothing?
Absolutely nothing.
It's absolutely nothing. Yes.
I'm over 60, but if you're under 60, the average prescription item costs about $10.
Yes. Is 60 the cutoff age in the
Yes.
UK for retirement, or you're considered
No,
elderly?
it's
or
for healthcare.
for health care. So 60 years old, all kinds of benefits occur. If you're a physician, you could retire.
Yeah.
Is there a time limit in training in the UK? How long can a young doctor work, or is there? Do they have hour here? It's pretty unlimited, or at least some steps. It's changed recently, but
The European Union decreed that trainee doctors must work no more than 48 hours a week.
well, that's unbelievable. Of course. I mean,
Well,
that's-
it has been a disaster for all, because the doctors in surgery particularly are not getting enough training in practical procedures, and the attendings don't know who's going to be the resident with them on the ward round.
Yes. Yes.
And patient continuity of patient care has gone completely.
Yes.
And I see the troubles are starting to arise here, even with an 80-hour week.
Right. It's the interface, isn't it? So
Yeah.
for the audience, it's the handoff that occurs when you're in the hospital, and one team passes your story along to the next one, and so if there's an error, there can be big problems.
I must say, when I do some of my teaching at the medical centre in Macon, the handover has been pretty good.
Yes.
I say I'm impressed with Dr. Scagliotti, who I think's done quite a bit towards.
Well, that's a good story. And so you've actually been teaching in Macon at Bursa, and teaching. You've been here. How did that happen?
I've taught all over, but all I can say is that the standard of teaching at Mercer Medical School is excellent. It has its faults. I make my feelings. I'm not saying what, because it would be unfair. But they use very similar system to the Oxford tutorial system,
Yes.
where as a tutor I have just 6 students,
Yes.
and I have a phase,
Yes.
which in fact is musculoskeletal for me.
Yes.
And they have an exam at the end. It's very good, and by the time they finish their 2 years at the medical school,
Yes.
I would say the standard of knowledge of medicine and often diagnosis and
yes.
management is as good as a newly qualified doctor in England.
Well, that's a rather good compliment. That's a quite good compliment, I think.
When they finish their training
Yes.
at the medical centre, I think that the training they get there
Yes.
is excellent.
Yes.
I can find faults, but then everywhere in the world I've been, there are faults.
A lot of it is the time and the intensity of the experience. I mean, if you're on some 48-hour work week, I mean, that's just an inadequate amount of time, isn't it, to really do it? Yes, we all agree with that. That's just ridiculous. Nobody can learn anything. I mean, you've got to it's total immersion. Well, now you mentioned that you would spend time at Oxford. Is that right? Or you were Mr. Pennypacker?
No, I was clinical tutor in Oxford.
Yes.
Which was what you would call here as midway between 4th year and chief resident.
Yes, yes.
It was very good, very hard work. We worked about 100 hours a week.
Which is a normal work week.
Normal for
actually,
us.
I think I still do.
Yeah.
I think that's my work week.
And but it was a tremendous experience, and there were a lot of interesting people there.
Yes.
Who came from all parts of the world to see and teach. So it was a good grounding in international relations.
Yeah, so and I mean, you've certainly you've traveled from.
But I think of the interesting people I met or been taught by, my first mentor and teacher was Sir Peter Medawar.
Yes.
I think every kidney transplant patient in the world should be grateful to him, because he broke the code.
Oh, he did?
Yes, he did the elegant experiments that proved that you could transplant organs eventually.
Yeah. And your background is in physiology. Were you have an interest in the kidney, or I mean?
No, we did. I was more neurophysiology.
Aha. Okay. Well.
You know my tutor, I'm sure, Sir Bernard Katz.
Oh yes, a rather famous name.
He was a very quiet man, but very, very good teacher.
Yes, yes.
I used to pull micropipettes for him, and you know what a micropipette is.
Yes. Oh, that's right. I've had some experience myself. And so, did you miss bench research, and that's always.
I did do, and I miss it now. I'd like to have gone back to it, but I'm getting beyond the age when I could really go back.
Well, it's good to have had those experiences. You've had a lot of adventures. Is there any continent you've missed in your travels? Have you been to all of them, or
I've been to most?
Most, yes. And just in speculating about what the future holds. Do you have any speculations about, let's say, how healthcare is going to evolve as you look at your career?
I think that healthcare will evolve. I mean, minimally invasive surgery is now very much to the forefront.
Yes.
Which means patients don't suffer so much. But how far it can go, I'm afraid I feel the manufacturers are pushing the development faster than the surgeons are able to cope.
Well, why don't you speak to that point? So do you think that you have a system where you have different kinds of companies that have different kinds of products? Do you think that's having an impact on the direction of healthcare?
Well, I've seen it happen where, we've got this instrument you can use.
Yes.
And they push it.
And so that's having an impact.
Yes, I think that and also joint implants are going to change, I think, for the period of time.
Yes.
They begin to show their problems.
Is there a difference in the UK? I mean, the government just buys everything, does it not? I mean, the surgeons don't have the choice of picking.
In the private sector they do, but in the government sector, no. You have certain provided employers.
Yes.
suppliers rather.
And most people in the UK are in the national health. How many people actually are in the private healthcare system there?
What do you mean,
percentage are you-
attendings?
No, well, I mean, in general, is it 90%?
No,
in the public, or
about 7% of the population are privately insured.
7%.
Of which about a third are actually private subscribers. They're not part
Yes.
of a company scheme.
Yes.
I was an advisor to one of the big companies for
Yes,
about
yes.
5 years.
So a relatively small number of people in the UK have access to private health care.
But more and more people now are purchasing what they call fixed cost surgery.
Yes.
For instance, a hernia would cost, let's say, $2,000.
Yes.
That is a fixed cost.
Yes.
If anything goes wrong, that is accepted in the
Yes.
charging, and people are doing that
Yes.
because instead of taking a long vacation overseas,
Yes.
they find it's worthwhile to get something done
Yes.
privately.
And some people go to India for their surgery.
Oh,
Is
so
that
I'm
correct?
told, yeah.
So you're told. Well, you know, it's been great talking to you, and we hope you'll come back and see us some more. Are your travels going to take you back to this part of the world, or are you headed off to?
Well, I've had reference that I might be asked back next year.
Well, great. We'd like to see you back, and it's just I hope that you know your journeys will continue to cause the obvious increase in wisdom I've observed tonight here.
Well, my wife and I like the area very much, and I've been coming here for many years,
Yes,
not
yes,
just to
yes,
teach.
Yes.
And I really enjoy the area, and I think the medical centre's got a good reputation, and I think it'll continue to grow. And I hope that they are part of the university
Yes.
as they should be,
Yes.
because they do teach.
Yes. Well, Robert, thank you for coming, and it's been a joy talking to you tonight, and we'll have you back.
Thank you very much.
Thanks. Thank you.
This program is brought to you by the Georgia Neurosurgical Institute. For over 50 years, rendering neurosurgical care to patients of all social conditions, treating complicated problems involving the brain, spine, spinal cord, and peripheral nerves, endeavoring to encourage quality care, medical research, innovation, and education on a local, national, and international basis.